Hello everyone, this is a surgical video demonstration of the rhomboid flap. Case details: it's a 61-year-old male patient, farmer by occupation, who came with blackish discoloration in the left side of the neck since 5 years, with ulceration and bleeding from the lesion since past 15 days. He had no history of itching. No similar lesions were noted in the face, right neck or oral cavity. He had no comorbidities. He was a tobacco chewer and a BD smoker since past 20 years, reformed 2 months back. On local examination of the left neck, there was a nodular, well-defined blackish lesion with surrounding rolled out edges which was present, measuring 3 into 2.5 centimeter, extending superiorly 1 centimeter below the lower border of the mandible, inferiorly 6 centimeters superior to the clavicle, medially 1 centimeter from the midline, and laterally 1 centimeter from the anterior border of sternocleidomastoid muscle. The contrast-enhanced computed tomography of the neck showed a 35 into 27 millimeter soft tissue density confined to the skin and subcutaneous tissue with 5 millimeter depth abutting the platysma without extension deep to the platysma. The fat planes with the carotid and jugular vessels were maintained. There were no cervical lymph nodes. The biopsy from the lesion showed adenoid basal cell carcinoma. The patient was diagnosed as basal cell carcinoma left neck, stage CT2N0M0, and he was planned for excision with reconstruction with rhomboid flap under general anesthesia. Local flaps are versatile reconstruction option for small defects of the face and neck. They own advantage of reliable blood supply and donor-recipient color match. The choice of the flap depends on the relaxed skin tension lines and anatomical subunits. Rhomboid flap is a transposition flap with predefined internal and external angles. It is a flap of skin and subcutaneous tissue that is rotated around a pivot point into an adjacent defect. The flap should be positioned in the direction of minimum tension and maximum extensibility. After examining the lesion, the outline of the rhomboid flap is marked. It is a parallelogram with equal length on all sides. In this case, it is 4 centimeters. The internal angles are marked, that is 60 degree and 120 degrees. And the flap of equal dimension is drawn adjacent to the defect. Infiltration with local anesthetic, 1% lidocaine solution with epinephrine 1 in 1 lakh is done on all the sides of the defect. And the markings are revised, and the length is 4 centimeter, which is taken on all sides, and the angles are marked, that is 60 degree and 120 degree. The skin is incised on all sides. The incision is deepened till the subcutaneous tissue on all the limbs. The platysmal layer is also cut. The incision is then taken deep to the platysma to include the platysma in the specimen. The specimen is then removed after applying adequate ties. The specimen is oriented while it is still attached to the primary site. The entire resected specimen is sent for frozen section examination. In this case, frozen section revealed all margins free of tumor. After obtaining the results of frozen section examination, we went ahead with reconstruction. After a thorough wash, the size of the defect is again measured to ensure that the length of all limbs are the same. In this case, it is 4 centimeters. The limbs are labeled to match the final closure as A dash, B dash, and C dash. A vertical limb of the same length, that is 4 centimeter, is taken from one of the 120-degree angle of the rhomboid. This forms the flap body. At the end of this line, another segment angled at 60 degrees is drawn, and this forms the tip of the flap. The final shape resembles a peninsular triangle with curved trajectory. The skin, subcutaneous tissue, and platysma is incised, and the edges of the defect are then undermined. The edges are undermined on all the sides. The limbs are then approximated to meet their corresponding sides. The closure is started in 2 layers with 30 PDS and 30 Prolene sutures. This is the photo of the patient post-closure. The histopathology report showed features suggestive of adenoid variant of basal cell carcinoma. All peripheral resected skin and soft tissue margins were free of tumor. This is the photograph taken of the patient during his follow-up visit, 3rd month post-surgery, and it shows a well-healed scar. Thank you.